doctor.
Hello, how are you, Vanshika?
I'm not that great, doctor. I had a doubt.
Okay, what is the problem?
So, I've been having white discharge from past 5 days. Is it normal
Okay.
or abnormal?
Okay, how are your periods?
They're pretty regular,
Okay, when was the last day?
around 8.
Okay, and the discharge, is it smelly?
No, it's not smelly, it's odorless. Doctor, could this be a yeast infection for me?
Right, yeast infections are very common, but the consistency of discharge defines it. And if it is persistent, you are taking like medicines on your own from the pharmacy, medical, then the infection gets converted into a yeast infection, which we usually call it as fungal infection. How is your discharge?
It is, the discharge consistency is not too thin, not too watery. It is in between.
Okay. Is it burning? Is it itching?
Yeah, a bit it is.
Okay. Are you using any soaps or intimate washes
Yes.
lately?
Yes, doctor, I've been using V-wash.
Okay. Usually V-wash is to be used for the cleaning purpose. I have seen patients using it for like past 3 months or 2 months. It is not to be used continuously. So if you are using it continuously, please stop this. We can use it like 15 days of usage and 15 days you can stop it. Whenever you get your periods, then the pads are to be changed every 4 hours, and this is the reason why females get rashes, and this again can lead to infection and white discharge.
Okay, doctor. Is it also related to my stress or hormonal issues that I get white discharge?
Yes, usually the discharge is hormonal only, hormones related discharge, and we have to follow the practices of personal hygiene. One more thing I can see commonly is usage of jet spray. Nowadays, jet spray is very common, and females use it commonly. The pH level of that vaginal area is to be maintained. Jet spray usually washes off the pH and it washes off the healthy bacteria which are present there. That is why jet spray is not to be used continuously. And water intake is important rather than cleaning it with the water.
Okay, so being hydrated is also a part of it.
Yes, right.
Also, doctor, do I need any test or follow-up appointments?
Yes, if it is happening again and again, then we can go ahead for the test. Otherwise, the medicines given will take care of it. Plus, follow-ups are essential when the discharge is there every month and it is thick and it is not with ovulation discharge. Whenever you take medicines and the discharge is not relieved, then you should contact your gynecologist for the test. And follow-up appointments are important because these treatments are to be taken continuously so that the infection gets cleared up. Otherwise, patients ignore it for like months and years, and this might land up in some greater infection later.
So, doctor, when should I actually go and connect with my gynecologist? Because I've been having white discharge and it is irregular. I have it for 5 days, then I don't have it. So, when is the time it is a serious note for me to connect my gynecologist?
Right. Usually, the discharge is common for 2 to 3 days. If it is happening for more than 3 days and it is associated with some smell, or you can notice some change in the discharge, then you need to visit your gynecologist. Okay, I want to tell you something about white discharge. It is a very common condition in females. Usually I have seen बहुत सारे पेशेंट्स आते हैं जो खुद से ट्रीटमेंट ले रहे, जो खुद से फार्मेसी से मेडिसिन ले रहे, प्लस बहुत सारे पेशेंट्स गूगल रिव्यूज पे रिलाई करते हैं फॉर द मेडिसिन. सो आई वांट टू टेल one thing, that if the discharge is happening for 2 to 3 months, then you definitely need to visit your gynecologist. Plus, the discharge, if it is happening after the age of 35 years and repeatedly, then you need to go ahead for pap smear test from your gynecologist, because repeated discharge can lead to a risk of cancer. So it is not to be ignored, and self-medication is not recommended. Thank you for your